Welcome back to Extra Perspective. This month marks 5 years since the World Health Organization declared the COVID-19 outbreak a pandemic. It led to mass lockdowns, testing, hospitalizations, social distancing, and many unknowns. Our lives were forever changed. ABC 7's Rosemary Montañez spoke to those fighting on the front lines about where the virus is now and how it's changed since.
The COVID-19 pandemic shut down the world, and El Paso was no exception. On March 11th, 2020, the World Health Organization declared the COVID-19 outbreak a global pandemic. Just 2 days later, March 13th, 2020, the first case of COVID-19 was confirmed in El Paso.
We knew it was coming, and it was just a matter of time. And so I don't think I was surprised, but it was more of a sense of, wow, here it is.
I think it was a lot of uncertainty. We weren't sure. I thought it'll never reach here. It wasn't something that we were starting to prepare, but I really didn't think it was going to come here.
On March 14th, schools were ordered to close and students began to learn remotely. March 17th, the city issued an emergency order that closed bars and limited capacity inside restaurants. Shortly after, on March 21st, the U.S.-Mexico border closed. On March 24th, stay-at-home orders were issued to help slow the spread of the virus. On April 9th, a man in his 80s was the first to die from COVID-19 in El Paso. Medical professionals were the first to witness the COVID-19 pandemic unfold. Back then, Dr. Ogechika Alozi was the chief medical officer at Del Sol Medical Center. He told me the realities of being on the front lines.
Patients that would come into the emergency room, we would try to figure out our capacity in the emergency room. I was there when we set up tents outside most of the major hospitals. Have tons of stories of people that survived and people that unfortunately passed away.
Was there ever a moment you were afraid, maybe for your own life, for your family's life?
I was always afraid. I think it was fear of the unknown more than anything else, and I was a little bit different then. I was heavier, I have some health conditions, and so I was definitely worried.
Victoria Brunsink has been a nurse for 14 years. She says one floor at University Medical Center was immediately converted to solely handle COVID-19 patients. She told me treating COVID patients was vastly different than any other patients.
It was different because of how fast things moved, how fast they got sick and sicker. We knew that after they got intubated, their mortality rates went up, and they would code, they would die.
Brunsink continued to work daily, even renting a hotel room for 1 month to stay at as she feared spreading the virus to her family. She says patients from all ages died, many with underlying health conditions. And in their final moments, just before getting intubated,
I used my personal phone to have them call, if they could, FaceTime, or at least call their loved one, most likely one last time before.
I asked her why she did this, knowing she could contract the virus herself.
So they could talk to their families, because most likely it was going to be the last time.
Day after day, she witnessed many patients die from COVID-19. On one occasion, she says 10 people died during her shift.
Was there ever a moment you wanted to maybe just quit your job and just go home and just stop the risk? What made you not do that?
The patients needed people. They needed the care.
As infections continue to soar and hospitalizations climb, El Paso was one of the hardest hit areas, becoming one of the epicenters of the pandemic in late 2020. Mobile morgues were set up to keep up with the large increase in COVID-19 deaths. Masks became the new normal. But in December 2020, the U.S. Food and Drug Administration approved the first COVID-19 vaccine, and they began to roll out in El Paso and the surrounding communities. According to the city of El Paso, over 364,000 people were hospitalized with COVID-19 in El Paso County, and over 3,700 people died. Dr. Alozi says there were many lessons learned from the COVID-19 pandemic.
I think the biggest two things were the sense of fear and unknown, and how it can really paralyze you as an individual and one as a community. I think the other thing is the sense of hope when we did get vaccines that offered protection, and how the community really rallied around the uptake of those vaccines.
Alozi and Brunsink both say the memory of COVID still lingers.
You know, the honest truth is that COVID feels as if it's a memory and it's not really in people's consciousness. I know that a lot of people have been scarred by the memory of COVID, and there's a lot of people that are still very anxious and afraid of it.
I asked Brunsink what she would tell herself 5 years ago during the worst of the pandemic.
It gets better. It gets better, and the numbers went down. Now we rarely see it in the ICU setting. So, hang in there because it does get better.
She says they're prepared for whatever may come at them next. Rosemary Montañez, ABC 7.